Hello, Dr. Darty here, back with Chapter 14, the Male Reproductive System. Let me angle this a little better. There we go. As I told you last time, my husband is a urologist, and in addition to being the surgical specialist for the urinary tract, they are the experts in male reproductive health, somewhat analogous to a female's gynecologist. So, we're going to go through some of the words that have been featured prominently at our dinner table over the years, and there are quite a few of them listed here. It's basically an anatomy lesson, so we'll go along. You may want to refer to some very excellent diagrams on page 372 as we do this. The table on page 373 has a list of very interesting words. What is perhaps most interesting is the order in which they're presented. I guess it's alphabetical. Yes, it appears that it is, because it certainly is not physiologic. So let's take a look at the organs that comprise the male reproductive system. Perhaps the biggest surprise for early students in healthcare, even people who thought they were pretty familiar with how the male reproductive system works, is the long journey that a sperm takes from the testis, where it was formed, to the outside of the male's body. I think a lot of us growing up sort of thought of it as like a pistol. They're made here, they're shot there, end of story. But it turns out that that sperm takes a very long trip that actually leads it up and around the back of the male's bladder and over the top before it leaves the body. And that's illustrated nicely for you in the diagram labeled A on page 372. If you look at the diagram B, it could be confusing unless you realize that you are looking at a posterior view. You're looking from the back of the gentleman toward the front. And then we have a gentleman in an unfortunately embarrassing position in diagram 14.2. That diagram is to introduce you to the word perineum, peri. The perineum means something different entirely. So perineum refers to the floor of the body for males or females. And it's roughly a diamond-shaped structure that the top of the diamond would be the pubic bone, and the middle of the pubic bone called the symphysis. The bottom of the diamond is the anal opening, and then the bony ischial spines, that's the part we haven't really talked about, but some little, your sit bones, if you will, on either side form the lateral aspects of the diamond. And that's illustrated for you in 14.2. Males and females both have a perineum that are demarcated by those same anatomic landmarks. So we'll just kind of go through some of the words for the male system. Males have a scrotum or sac that contains the testis or gonad where the sperm are made. Interestingly, in human, like we have a brain and it is protected by our bony structure, the top of our skull, our cranium, and we have heart and lungs that are protected by our rib cage, and then we have the testis, which is, at least half of what the fate of the human race depends on, along with the ovaries in the woman, and they're like left out on the front porch. That always seems odd. They seem in a very vulnerable position, but there's a good reason for that. It's a quirk of physiology that for sperm to form properly, they have to be at a temperature about 3 degrees centigrade lower than core body temperature. So the testes are kept on the scrotum, out on the front porch, so to speak, to keep them chilly. The temperature can be regulated. There's a system of muscles. This may not come as a surprise to you, but when the temperature gets too low, there are muscles that can pull the testes back up close to the body. There's a funny Seinfeld episode about shrinkage. And when it's very warm, those same muscles can relax to let the testes actually hang lower so that it's even cooler. Fear can do the same thing, can pull testes up closer to the body. So if someone is threatened, then their body automatically takes care to protect that precious resource of reproductive cells. So the sperm are formed in the testes. Testes is plural, testis is singular. We know a lot of other names for that, but we're going to go with the anatomical names, testis and testes. And then they move by the ductus deferens or vas deferens. You probably know it by vas because you've heard of vasectomies, where that is ligated or cut to prevent the sperm from leaving the man's body. So you see that they go up through the ductus deferens or vas deferens all the way around the back and over the top of the bladder, then down through the male. You can see how they join the male urethra. They're near the prostate gland, and they leave via the penis. In males, the last part of the urinary tract and the last part of the reproductive tract are the same tube. Females, you probably know, have separate tubes for their reproductive tract and their urinary tract on the floor of the body in the perineum. You knew that already. There's another structure there that plays an important role. If you look, you'll see there's sort of a little shrimp's shaped structure that sits on top of the testis, and it is called the epididymis. And that is a hard word for students to learn to spell. Just remember, it's all I's. There's no U's in epididymis. It's epididymis. There's a Y in there, but no U's. All the words that all the letters you might want to substitute are I's. It can become inflamed, and epididymitis is a pretty common occurrence, usually successfully and easily treated with some antibiotics. All right, so let's look at some of these words. In addition to sperm, the composition of semen, the male reproductive fluid, is several different substances added by 3 sets of glands. And that's one reason why they give you the diagram on page 372. So let's sort of track the journey of a sperm as it leaves the testis. If you flip on over to 374, you will see that they have done a nice section of a testis to show you all these little curly tubes sitting in little chambers. And what those little tubes are called seminiferous tubules, sperm factories basically. When the sperm leave those little chambers, those little tubules, they are not able to do their job yet. They're just kind of clueless. They don't swim very well. They don't even really look a whole lot like sperm just yet. So they have to go to sperm school, and that's what the epididymis is. If you look near the top of the testis, the top of the epididymis up there, that would be like kindergarten, first grade. When they get there, they're like, I don't know how to do this. But as they move down through, and it takes weeks for them to actually move through all the grades of sperm school, if you will, then they become better swimmers. They're potentiated. A lot of good things happen to them so that they're ready to graduate and go out and do their job. So you can see down there at the very tail of the epididymis, that's where we're getting ready to join the vas or ductus deferens. Now, there's a journey up through into the man's trunk, into the lower part of the man's trunk up there. And that structure, along with the blood vessels, the arteries and veins that serve the testis, are called the spermatic cord. So you have the ductus deferens, the testicular artery, the testicular vein, all enclosed in a tube of connective tissue, and that's called the spermatic cord. So it's a pretty good system most of the time. Unfortunately, things can get a little loosey-goosey in there, and the testis can twist on its own blood supply and basically strangle itself, deprive itself of oxygen. It's a very painful condition, can happen very abruptly, and as our PowerPoint points out, a true emergency. If it's not straightened out very quickly, then the testis may become necrotic or die, and therefore non-functional. So that is called testicular torsion, and it needs to be untwisted quickly, and they usually perform what's called an orchiopexy. Orchid always refers to the testis. So they do an orchiopexy. They put in a little suture to make sure he can't twist on his own blood supply anymore. So that's the spermatic cord. After the sperm goes up the vas deferens or ductus deferens, you notice there are some big glands on the back of the bladder. They're pictured sort of in purple on page 372. Those are called seminal vesicles or now seminal glands. You will hear seminiferous glands or seminal glands. And that's where most of the liquid volume of semen comes from. It has substance that nourishes the sperm because they're very simple structures. They do not pack a lunch with them. They have to be fed along the way. It's a real high energy situation for those little cells. More on that in a minute. So most of the volume of semen comes from those seminal vesicles. If you follow, then it comes on down by the neck of the bladder, and you see that peach or donut-shaped prostate gland. Please remember there's only one R in prostate. Prostrate means to fall down flat. Prostate is the gland. And it also contributes some volume to semen and some chemicals that help the sperm to be livelier. Then all the way down right at the floor, you have to really look to see them. They're tiny little glands called bulbourethral glands. Their main role is to provide lubricant that appears at the tip of the penis when a male's aroused to make the journey that they need to make a little more comfortable for everybody involved. So 3 sets of glands in the male reproductive tract. The big old seminal vesicles or seminal glands, they're sometimes called, the prostate gland, and then the tiny bulbourethral glands. Those are the 3 sets of glands that you need to know about. They're all obviously exocrine glands because they have ducts. We know what a penis is, we know what a scrotum is. The technical term for sperm, we don't say sperms. Sperm, like deer, can be singular or plural. If we're being very official, we say spermatozoa. So that is there for you on page 373. I think we said all those words. Good. Another thing that the testis does besides making sperm, it is also an endocrine gland. Do you remember endocrine glands? Those are glands that secrete hormones into a body fluid, usually blood. So the group name for those is androgens, meaning man hormones. The one that we're most familiar with, and the primary one, is testosterone. I think we all know that. The androgens, specifically testosterone, are responsible for allowing sperm to be formed. So when the testis begins to mature at puberty, that's when sperm formation also starts. And that's also when we start to see little boys start to look like men. So they get bigger muscles, heavier bones, facial hair, the larynx becomes larger, so they get a deeper voice. So all those things are considered secondary sexual characteristics that go from the androgen, including an increase in libido. I think there's a whole industry around Axe body spray because at puberty, libido starts happening. Let's move along. If a testis does not descend into the scrotum in the last part of pregnancy, before a little boy's born, his testes that develop before he's born in his abdomen should move down into the scrotum, but sometimes that doesn't happen, and it results in cryptorchidism. Your book has cryptorchism. I looked this up, and that is an acceptable term, but the more common term is cryptorchidism. You can say it either way. It means literally a hidden testis. That needs to be corrected before a little boy is a year old, because if it remains too long at the higher body temperature we talked about, then long-term damage can result. And if it is never moved down where it belongs, it has a higher chance of becoming cancerous later in life. We talked about epididymitis. Hydrocele is extra fluid in the scrotum. Baby boys are often born with it. It's usually reabsorbed, but it can happen later as a result of injury or as a result of a hernia. You can see it. We talked about orchiopexy. Orchiectomy is removing a testis. The most common reason earlier in life is for cancer, but sometimes when men have prostate cancer later in life, which is being enhanced, if you will, by androgens, then an orchiectomy may be done to remove the testis so that the cancer is no longer fueled by testosterone. A spermatocele is a cyst on the epididymis that has sperm inside. A varicocele, they're very common. These are dilated veins around the testis, feels, they say, like a bag of worms. Usually not anything other than perhaps a cosmetic problem, but if it's big enough, it can cause extra heat, and some people think that it can be a factor in male fertility. Moving on. I believe we all know the word ejaculate or ejaculation for the noun. Ejaculatory is the adjective. That is the act of the semen carrying the sperm leaving the male body. Typically during sexual intercourse, that's when it happens, and that's how women get pregnant, but your mom probably explained this to you or your dad. Motility is a critical factor for sperm. As we said, they have to be able to swim. Sperm is a really interesting cell. It's the only motile human cell. It's the only flagellated human cell. It has a tail that works like a rotor, almost like an egg beater, that allows the sperm to swim, called a flagellum. Plural is flagella, so sperm have flagella. And they need to be able to swim because they have to go a long way once they get inside the female body for fertilization to occur. More on that later. But it's fascinating. But if a sperm is not motile, not adequately motile, he's never going to be able to get the job done. If you want to see a really good example of this, watch the opening credits of Look Who's Talking. We talked about the prostate. Prostate glands, as I'm sure you know, can become cancerous. Several famous people have succumbed to prostate cancer. And the test, there are a couple of ways that that's detected. Digital rectal exam, because the prostate can be palpated through the male rectum. They don't enjoy that, but it's an important part of a male physical exam. And then there's a test called PSA, prostate specific antigen, a blood test that if the level rises to a certain level, especially if that happens over a short period of time, that is an indicator of prostate cancer as well. Moving on, page 381, azospermia means there are no sperm there. That's always really bad news if a couple's having trouble conceiving and the man brings in a specimen and there are no sperm there. That is called azospermia. If there's sperm there but not enough, that's called oligospermia. Infertility means inability to conceive. Nocturia, I don't know why they put that in with this part, but they did, is excessive urination at night. People who have an enlarged prostate, and we said they're not really fully in retention, but they don't empty their bladder well either. One symptom can be an increase in nocturia, having to get up at night several times to go to the bathroom. Prostatitis is an infection of the prostate gland, again requires treatment with an antibiotic. Oh, I'm seeing if there are any in these. I just don't want to read words to you. On page 383, they go through some more anatomic words. The tip of the penis is called the glans, and it does not have a D in it. So watch that one. I've seen that mistake made a lot. Hypospadias is where instead of being at the tip of the penis, the urethral meatus, the opening in the penis, is on the underside. If it's just a little on the underside, that's kind of normal and not important. But if it gets way on the underside, especially if it's more a slit-like opening, that can cause problems with both urination and sexual function later on. So that is mentioned. The prepuce is, or prepuce, you hear it's pronounced, is the covering over the glands of the penis in an uncircumcised male. Circumcision is the act of removing that, also called the foreskin. Priapism, people kind of laugh about sometimes, but it's no laughing matter. That's when an erection does not go away. If you've seen commercials on TV for the erectile dysfunction drugs, they'll say consult a physician immediately for any erection lasting longer than 4 hours. And I was surprised how many of my students thought that was just sort of a plug for the drug, that look how well it works. It can last more than 4 hours. It's not. If an erection lasts a long time, irreversible damage to the penis can occur. It's a complicated mechanism, but it really is an emergency if it won't go down. Spermicide is a chemical used either in conjunction with the female diaphragm or as a foam that kills sperm in birth control. See if there are any other words here. Smegma is the white, cheesy-like substance that collects under the foreskin or prepuce of an uncircumcised male. Then they go on to the delightful topic of, they say STDs. The current preferred term is STI, not STD, sexually transmitted infection rather than disease. And they list a bunch of these that you don't want on page 385. You've probably heard of many of them, the worst arguably at the top being AIDS, acquired immunodeficiency syndrome. You can obviously get AIDS in other ways, but it can be a sexually transmitted disease. Chlamydia, very, very common epidemic in this country. Gonorrhea, making a big comeback after not being on the wane for several years. HIV is the virus that causes AIDS. HPV is human papillomavirus, causes what we call venereal warts or genital warts. Let's see, syphilis, also seeing more of that than we once did. And trichomoniasis, or as people usually say in slang, trick, another sexually transmitted infection. So you can read about those on page 385. And then 387 just describes some of the procedures that urologists perform. And I'll let you have a look at those. I think that's enough male reproduction for today. If you have any questions, send me an email and we'll see if we can't clarify that. I'll call in my expert if I don't know the answer. Thanks.